On our land, we are fighting Russia, which brings horrible silence with its bombs, the dead silence. Fill the silence with your music. Fill it today to tell our story.
Chris Stapleton was among the performers who answered that call. He took home trophies for Best Country Album, Song, and Solo Performance. Olivia Rodrigo is a 19-year-old triple Grammy winner, collecting Best Pop Solo Performance, Best Pop Vocal Album, and Best New Artist. Silk Sonic went 4 for 4, including Record and Song of the Year for Leave the Door Open.
We call that a clean sweep. Let's go for 4!
But the night's biggest winner was Jon Batiste, who won 5 Grammys, including the night's final prize, Album of the Year, and marveled at the power of music.
It's like a song or an album is made and it almost has a radar to find the person when they need it the most.
In Hollywood, I'm David Dimble.
While film singer Olivia Rodrigo's major category wins were enough to catch netizens' attention, her brief appearance in BTS's Butter performance only made her more of a trending topic. K-pop idol V whispered to Olivia and showed her a mysterious note before going on stage to sing. This is the first time BTS performed on the Grammy stage in person. Vocalist Jin could not dance alongside other members for the entire song because he is recovering from surgery on his finger. But fans were thankful all 7 members made it on stage, with Jungkook only being released from COVID-19 quarantine last Saturday. BTS also attended as nominees for a category but lost Best Pop Duo or Group Performance to Doja Cat and SZA's Kiss Me More. And that is it for tonight. Join me again on News.ph at 7 p.m. I'm Pia Ontiveros for Newsnight, where we go above and beyond the headlines.
This program is brought to you by
This program is rated PG. It contains themes and scenes which may not.
Once might be a little funny, but when hiccups won't go away, they can be annoying and sometimes even embarrassing. When you hiccup, there's a sudden spasm in your diaphragm, and this causes your vocal cords to quickly close, leading to the characteristic hic sound. Now, they're usually harmless and can be stopped with simple remedies, but from holding your breath to frightening yourself, what really are the effective ways to get rid of them? On the program today, we'll talk about why hiccups happen, effective ways to prevent and get rid of them, and when they're considered a cause for concern. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. For many, hiccups are over quickly. But did you know that the longest bout of hiccups lasted for 68 years? Our guests are here today to tell us why they happen and medical conditions that can be linked to long-term persistent hiccups. With us is Dr. Lenora Fernandez. She's a pulmonologist from Asian Hospital and Medical Center. Also with us is Dr. Jose Miguel Medrano, who is a neurologist from St. Luke's Medical Center. Now, we're all familiar with that striking hic sound of a hiccup. Now, earlier on the show, we mentioned that it's caused by spasm in the diaphragm. Dr. Lenny, tell us more about this. Could you explain to us the whole process of how a hiccup occurs?
So usually we breathe normally and we don't feel it. You're not conscious about it. But when a hic comes or a hiccup comes, the spasm that you mentioned, that would be a sudden inhalation, and then also our vocal cord closes at the same time. So we create that sound. Now that is something abnormal, and there is what we call the abnormal reflex. So usually there would be an abnormal thing that would either go or stimulate the nerves here in the face, in the ears, in the nose, or the lungs, or even the stomach. And that now creates that abnormal spasm of your diaphragm. So literally anything can cause actually a hiccup.
Hiccups can come and go for no apparent reason, but there are some factors that can actually set them off. Dr. Miggs, let's talk about these triggers.
When we talk about hiccups, we just have to identify that there are two major types. You have your very benign, self-limiting hiccups na nawawala lang after a few minutes to maybe an hour at most. These ones can be caused by eating too quickly, ingesting spicy food, or even ingesting a lot of air habang tumatawa po tayo or umiiyak. And sometimes it can also be with a heightened emotional state. Typically, pag very excited or in shock po, you can develop hiccups suddenly or in cases of panic attack.
One common is that eating too much or too quickly as a source of the hiccups. Dr. Lenny, can you explain why this happens? Why a lot of people experience this, pero is it really linked to food per se?
So it's the sudden expansion of our stomach that would now stimulate that nerve. We call it the phrenic nerve, and that is the same nerve that actually would supply our diaphragm. So the diaphragm would spasm, and that now creates the hiccups. So it's the sudden actually distension of the stomach which stimulates it. So carbonated drinks, pag umiinom tayo ng mga soft drinks, medyo na marami, kapag kumain ng sobra, and then alcohol also causes that distension together with the liquid intake. So that now creates the distension and leading now to the hiccups.
And one that might not be so common is what Dr. Miggs mentioned, is the hiccups triggered by emotional factors like stress or excitement. Dr. Miggs, can you talk more about this? How can emotions cause that spasm of the diaphragm?
So yung medical term of hiccups is singultus. So that means na in Latin, to catch one's breath while crying. So parang there's always been a historical basis for an emotional state causing hiccups. And the way the brain processes and prevents hiccup is not entirely mapped out yet. But what we know is that yung areas of the brain that control breathing receive information from internal sensors within our bodies, the chest, the stomach, and even in our throat and in our brain. And they are controlled through neurotransmitters, which may be dysregulated or changed if you're in a very heightened emotional state or if you're anxious or under chronic stress.
Now, we all experience hiccups from time to time. Anyone can get them, even infants and children. Now, usually they go away within a few minutes, but there are some that could last for hours, even days, even months for that matter. Dr. Lenny, please explain to us the difference between chronic and persistent hiccups.
We usually have the time cut off, so it would be 48 hours. So if it's less than 48 hours, we can say that that is acute and it can go away by itself. But if it persists beyond 48 hours, then that is when we say it is chronic and you would need help by the doctor, because sometimes we would need medications to really get over the hiccup. But one thing is very important, we have to trace the cause for that. And the one that you mentioned, that it lasted for 68 years, that is intractable hiccup, which now is beyond 1 month. So I myself haven't had a patient that the hiccups lasted for more than a month. My longest is probably 2 weeks.
Now, if your hiccups last longer, as mentioned, or longer than 48 hours, it might be your body's way of telling you about an underlying health issue. Dr. Miggs, what conditions are linked to chronic and persistent or even intractable hiccups?
Intractable hiccups, first of all, are still extremely rare. But when they do occur, most of the time, it's because may problema po in one small part in the brain or brainstem. And that can be caused by very small strokes or tumors. It can be caused by multiple sclerosis, or it can be caused by certain drugs like medications for Parkinsonism. They can also be seen as complications from anesthesia. So sometimes after anesthesia, you'll have prolonged hiccups for maybe 2-3 days after, although that's not very common too. And lastly, if you have diseases of the stomach itself, like if you have very bad or severe gastric reflux or paralysis of your GI tract or stomach, pwede po talaga mag-cause ng intractable hiccups po yun. It's just important for us to know, so sometimes after anesthesia, you'll have prolonged hiccups for maybe 2-3 days after, although that's not very common too. And lastly, if you have diseases of the stomach itself, like if you have very bad or severe gastric reflux or paralysis of your GI tract or stomach, pwede po talaga mag-cause ng intractable hiccups po yun. It's just important for us to note that hiccups are very rare, the sign of a first sign of a disease. So if you do have that for that long, that's the only time you should really consider that it's because of a secondary problem.
Dr. Lenny, when it comes to hiccups, for the most part, a lot of people find it annoying maybe or somewhat, but is there ever a possibility that the breathing can be disrupted because of the severity of the acute hiccup?
Yes, definitely, because it will interfere with your normal breathing, especially if you're having probably more than 10 hiccups in a minute or probably in an hour. That can definitely interfere with that. And then also, they have seen that if you have prolonged hiccups, then it can even mess around with our esophageal sphincter there, the valve there, and it can precipitate even more hyperacidity. So that's the other complication of prolonged hiccups. But definitely for breathing, yes, it can interfere with our normal breathing if it's very frequent.
Chronic hiccups can impact your day-to-day life. It can affect your quality of sleep and your eating habits for that matter, which can lead to exhaustion, dehydration, or even worse. So it's vital to see your doctor right away if you're experiencing them for a prolonged period of time. Now, the cause of hiccups remains a mystery, but there are a number of scientific theories. We'll discuss some of them when we return. You're watching MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. Hiccups usually happen suddenly, and even until today, doctors aren't really sure what may cause them. Let's talk about some of the reasons why people may have hiccups and probably some of the concerns of persistent ones. Dr. Lenny, are there any physical characteristics of a person in their airway that may predispose them to be more susceptible to having hiccups?
So some would have anatomic abnormalities really. Anything pressing on the nerve can cause the hiccups. The nerve supplying the diaphragm, for example. There are some with acid reflux. That one is one of the most common causes of hiccups. Again, because there would be stimulation of that nerve that would now cause the spasm of the diaphragm. And then as Dr. Medrano already mentioned, brain problems can also predispose to that. And the others would be, as I mentioned, the loose sphincter there that can be tied up with the reflux. That can also predispose to patients developing hiccups.
Others believe that hiccups begin in utero. They say that it's a training mechanism for babies to learn how to breathe. Dr. Miggs, is there any truth to this? Could you explain this theory to us?
So it's actually a very natural phenomenon, yung fetal hiccup. So sometimes when you do ultrasound, you will see the fetus actually having hiccups, and you may actually feel that in the third trimester for some mothers. If these hiccups are very persistent, all you need to do is take a nap or try to relax so that the baby will relax as well. On the opposite hand, if you don't feel these fetal hiccups, it doesn't mean that mahina yung lungs or breathing capacity ng baby. It's just that hindi nyo lang po siya nafe-feel masyado. And even if you do have fetal hiccups, it does not mean that you're at an increased risk of getting hiccups as you grow older.
A known reason for chronic or persistent hiccups is acid reflux. Dr. Lenny, you talked about this a little bit, but let's explain now. How does this trigger the hiccups? Or is this sort of a vicious cycle? Does it happen the other way around?
Yeah, you're right about that, Doc Freddy. It can be a vicious cycle. So first, the acid by itself can stimulate the nerves here, and that would now cause the spasm of the diaphragm. And then if there would be also buildup of acid and also distension of the stomach, again, that will stimulate the nerves that we mentioned and cause the spasm of the diaphragm. And if you're always putting up acid, it's always going up, and then you're having the hiccups as well. They've seen that the esophagus muscles would also have some abnormality eventually, and that now becomes the vicious cycle. More acid, and then more hiccups, more acid, more hiccups.
Now, Dr. Len, as a follow-up to that, for our viewers who are not so familiar with acid reflux, anong nararamdaman ng isang taong undergoing acid reflux?
So they can feel the heartburn, as we call it. So maaring masakit po dito. And then very madalas din sa mga pasyente, nagbo-burp sila. So that would also be the acid going up. And sometimes it can mimic even a heart attack, that you can have the chest pain there. And syempre, pumupunta sa mga pulmonologist, yung pangmatagalan na ubo, chronic cough that we see mostly in the afternoon. And then when they lie down by gravity, the acid goes up. That can also be a manifestation of acid reflux. Even it can stimulate even the ear sometimes, and they would still manifest with chronic cough.
Now, Dr. Miggs, earlier on the program, we talked about the pathway of how a hiccup happens, and if there's something interfering with that pathway, whether it be chemical, physical, it could be a tumor, physical tumor, or in the brain. Does this happen often? What I'm asking is, can hiccups be a symptom of an underlying brain condition?
Hiccups are an extremely rare first symptom of any condition. Oftentimes, you'll see hiccups with dizziness or hiccups with weakness or hiccups with some other condition like in multiple sclerosis. They're often accompanied by a loss of balance that's persistent. So as a single symptom by itself, it's not very common. But as a part of a constellation or a group of symptoms, it may be, that's the time you'll see it happen more often. And usually by the time other symptoms are present, the hiccups are the least of your concerns.
Now, there are also a few simple home remedies that might be able to do the trick. More on this when we return. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. People have very different and interesting ideas on how to cure the hiccups. I'm sure you've heard some people say that you should hold your breath while singing or drink upside down for 90 seconds. Of course, none of these treatments are scientifically proven. They may or may not work. But what are the tried and tested ways to get rid of hiccups? Let's discuss that. Dr. Lenny, what are some of the tried and tested ways scientifically, or maybe that is proven, or addressing some of the physiological parts of the body that can address hiccups?
So there was a Japanese group which did a study on breath holding, and they found that it was quite effective. But the rationale behind is that if when you hold your breath, your carbon dioxide actually increases, but it has to increase to such a level that it can now trigger the what we call the survival instinct for us to breathe. So it now would override the abnormal mechanism of the hiccups, and then your natural breathing now will take over. So that's the rationale behind it. But how long should you hold your breath? So we usually would advise that you hold your breath for 10 seconds and then do it 3 to 4 times. So that would mean do it in a minute, probably 4 times. And if that will not get rid of the hiccups, then you can probably continue it for 2 to 3 minutes. In that study, they had to hold it a little bit longer to gain a higher carbon dioxide, but 10 seconds will do for us. For some of you who might not be able to hold the 10 seconds of your breath, you can do it holding for 5 seconds, and then you can repeat the process until your hiccups disappear.
Some people even suggest gulping or gargling water to get rid of the hiccups. Dr. Miggs, is this effective, and is there a probable scientific reason why this would be so?
So similar to what Dr. Fernandez said, gulping water or large amounts of water or trying to gargle for long periods of time is just another way of holding your breath for 5 to 10 seconds. They are not really that proven to be as effective in preventing hiccups. But the theory is that it sorts of restores yung regular rhythm ng nerve tsaka ng muscle natin. Parang nare-reset siya. It's just different for each person talaga. There are some people who would respond well to that. But if others, for example, yung cause is really rapid distension of the stomach, even if you keep trying to reset yung diaphragm natin, pero distended pa din yung stomach, you might still get hiccups over and over. So you need to know ano yung reason why you're getting the hiccups first.
Dr. Mig, another common thing that people do is they try to address the reflex of hiccups by doing another reflex, and that particular a gag reflex. They try putting their tongue. Is there any scientific basis for this? Is this effective? This can actually be pretty dangerous at some point.
So that was actually already studied in independent groups in the US and in Italy. There was no evidence that triggering gag actually suppresses the hiccups of any person. They also try doing Heimlich maneuvers since may spasms diaphragm. And when you do the Heimlich maneuver, you actually try to trigger or stop the myoclonus of the diaphragm from happening. But again, that was not actually proven to be effective.
Dr. Lenny, walk us through a breathing technique that could actually work.
So aside from the breath holding thing, you can augment the diaphragm function by leaning forward while you are exhaling. So with that, doing it slowly so breath holding, and then try to exhale slowly and moving forward so that it will now push your diaphragm up or augment the exhalation. That can help sometimes. So others would also do they would try to lift their knees so that, again, it's to help contract the diaphragm. These are not really proven, but if it may help for you, then at least it's a safe kind of a maneuver.
Just as there's no proven method to stop hiccups, there's no proven way to prevent them as well. But if you experience hiccups frequently, reducing your exposure to known triggers might help. Dr. Miggs, let's go through some of the suggested ways to prevent hiccups.
So there's actually no really good way to prevent hiccups except for preventing what are the common triggers, including overeating or rapid eating, and controlling the way that we breathe when we have high emotional state. So one of the common causes is that when you're laughing too much, you actually swallow a lot of air. It doesn't all go into the airway, parang napupunta din siya sa tiyan. And that might distend the stomach and that might trigger your hiccups after. So if you can control that, you can prevent hiccups that way.
Now, if you're having a short bout of the hiccups, don't stress about those. They're harmless and should resolve on their own. But if it goes on for too long, ask a doctor what you can do. Thank you to pulmonologist Dr. Lenora Fernandez and neurologist Dr. Jose Miguel Medrano for being with us on today's episode. I'm Dr. Freddy Gomez, and thank you for watching NetTalk Health Talk on CNN Philippines. We'll see you again next time.